Welcome to our Mary Greeley Primetime Alive presentation, Supplements and Vitamins 101. I'm Vicki Newell. I manage the Primetime Alive program at Mary Greeley Medical Center. As a reminder to sign up for a program, to join Primetime Alive, to learn about our benefits, you can go to our website, mgmc.org/PTA. We also have all of our a link to all of our past presentation recordings if you'd like to see a past one. So if you go to that main page, the mgmc.org/PTA, you scroll down to the bottom, you'll see the most current video there that you can watch. If you look right below that, there's a button that will take you to our YouTube channel. So if you want to find one of our past programs. Our presenter today is Liz Burkland. Liz is a registered dietitian at Mary Greeley. She is certified in diabetes care and is currently pursuing certification in eating disorders. Liz is passionate about helping individuals heal their relationship with food and understand how nutrition supports overall health. Please welcome Liz.
It's been a while since I've done a primetime talk, so I'm excited to be here, but I got a little bit nervous as she was talking. So thank you all for coming. It's also my first time talking at this center, so that's also really exciting. But yeah, today we're going to talk about supplements and vitamins 101. I feel like in January, it's just a time where we get hit with a lot of messaging. So hopefully we can clarify some of those questions you might have. Or just kind of learn a little bit more about how supplements might fit into your diet. So yeah, today I'll get to an introduction. I'm going to talk a little bit about safety at the beginning with supplements. And then I just tried to predict what I think might be trendy in 2026 based on some of the questions I was getting towards the end of last year and some of the messaging I've been seeing so far this year, but of course I don't know what will be the big thing this year. So we'll hit on brain health, gut health, and longevity. Quick disclaimer, nothing in this presentation is meant to be taken as medical advice. I would definitely recommend that anyone talks to their medical provider before you start anything. There's definitely some potential interactions that we can run into with medications. Anybody with like liver or kidney issues, I would definitely talk to your provider before we start anything. Oh,
Like, does whoever's phone's going off, do they get there?
I'm not sure. I can wait a minute. Yeah.
That's maybe for everybody. If we can turn our volume off and turn it to vibrate, would be good.
All right. A couple of other things to keep in mind when we're looking at supplements. There's not a ton of regulation over supplements. So I would definitely say we need to do a little bit of our own research when we get into looking at starting something. The three places I have listed on the screen are some places that do some really good third-party testing. So third-party testing just means that the supplement company themselves have been doing all of their own safety testing on that. So these are some places that you might see written on a bottle or written on the website of a supplement company. And so those are some good things. I definitely would also talk about safety and risk. Like I mentioned, kidney and liver, those are the organs that really filter anything that we're eating or drinking or consuming. And so if we're taking a lot of supplements, it can get harsh on anybody with some kidney issues or liver issues, especially. So talk to your doctor about that. There are also some potential medication interactions. For example, since I work in a diabetes center, a lot of people are on diabetes medications. There are also some supplements out there, some that are really good, some that I don't think are very good, but that can also lower blood sugars. So we might run into a lot of like really low blood sugars with some of those situations. So I would just keep an open conversation, have your med list updated with whatever supplements you're taking or considering taking. Something else I think that is really important, especially today with social media and so much online use, is that there are a lot of people just selling their own products and they may not have the best interests in mind of the consumers. So I always want people to look at like who's selling this. Are they saying that they're taking it and they're seeing all these really great results, but they're also the ones who are selling and making a lot of the money off of the product? I'd be a little bit leery on that. Does it feel too good to be true? I've not run across any supplements that are like cures for any specific thing. So anything that's saying it's a cure or that life is going to be dramatically better by taking something, I would be a little bit leery on. Fear tactics are another big thing. Anything that's like feels really urgent, really pressing. You might, run into XYZ problems if you don't take this. That's just like a marketing ploy. So again, do your own research. And really an important one, I think, to consider is why are you taking it? I have some patients who come in and they have a list of like 8 or 10 supplements that they're taking. And if they can't tell me why they're taking it and I don't immediately know a reason why they're taking it, I usually recommend let's come off of some of those. Now, if somebody comes in with 3 or 4 and they know why, they know where they got it, they know who recommended it. If I'm not sure on what it is, I'll do some research to say, okay, like, yeah, it looks good. Or no, let's maybe stop that one. It used to be good. Now we're noticing that it's not. So ask yourself, why am I taking all of these? Do you know that answer? That's a good check-in point. And then I also just have to mention, we could be taking all the supplements in the world and it may not get absorbed super well if we're not doing some other really important things. So on all of the things we'll go through today, I have the supplement recommendation and I have like the food recommendation too, or the lifestyle things that we could be doing to help support whatever the purpose of the supplement is. So are you eating well? For example, fat soluble vitamins can't be absorbed if we're not getting some fat in our diet. So we need to be making sure that we're also doing these things. I think AIMS is a fun community to be in because I feel like AIMS people are just like really aware of healthy lifestyle things. So maybe it's redundant, but I just wanted to throw out these really important things as well. All right, so we'll get into the trends. First one is brain health. We have the Mind Diet program here, which is really cool. I know there's a lot of questions that come up on supplements there. I'm sure there are way more out there, but these are some of the ones I felt kind of comfortable talking about and some of the more common ones I think we run into. So first up is magnesium. Magnesium is used a lot for migraine headaches. It's also really good for just bone density. And it's potentially being looked at as a protective thing to take for Alzheimer's or Parkinson's. The RDA is the recommended dietary allowance. And so that just means like, where do we know is a safe level of magnesium for us to be consuming? And so 300 to 400 milligrams a day is considered safe. That is from food and potentially supplements. So I usually would recommend starting much lower than whatever an RDA is. Oftentimes, I didn't put it on here, but oftentimes we'll start at like 100 milligrams for a supplement, maybe 200 milligrams, and then we're going to try and get some through food as well, or we'll probably just naturally, whether you're trying or not, be getting some magnesium from our food. People who should avoid it, magnesium is cleared through the kidneys. So anybody with kidney disease, CKD, poor kidney function, definitely would recommend that we talk to your doctor about it. I would make sure that you're drinking plenty of water with it. I'm going to back up a little bit. Magnesium, there are a lot of magnesium supplements out there. I wrote glycinate because it's my favorite type of magnesium to be taking. The absorption is really good with magnesium glycinate. That tends to mean that we don't have very many side effects if the absorption is really good and that it's going to be doing what we want it to do. A really popular, really common one that people will be taking is magnesium oxide, which is actually not absorbed very well, but it's the least expensive version. It's thrown into a lot of supplement blends like multivitamins, that kind of thing. But if you're just going to take magnesium on its own, I would look for magnesium glycinate. There's also magnesium L-threonate. So there are a lot of really well-absorbed ones, but I think that's another confusing thing when you're standing in a supplement aisle and there's like 5 options for magnesium to take. Glycinate's my favorite one, but there are some other good ones as well. And then food sources, we can actually get quite a bit of magnesium in our diet. So I like to start there with people. A lot of people like nuts and seeds, so it's an easy recommendation. Pumpkin seeds are our best source of magnesium. Chia seeds are a good source. Sprinkle a spoonful of chia on your oatmeal or into your yogurt. That's good. There are a lot of chia pudding recipes that you can make as well. It's a texture that's kind of like tapioca, so it's kind of a squishy texture if you let it soak, but it's crunchy if you just eat it raw on things. So depends on the person. And then almonds, really any nuts have a good source of magnesium in them. If you're taking a supplement or if you struggle with sleep, magnesium helps people relax. So I always recommend taking it at night. I wouldn't recommend taking it in the morning because it could make you a little bit sleepy. It's not going to knock you out or anything, but it does tend to help with just relaxing our nervous system. So take it at night. There are a lot of like lotions and things that you can take for magnesium as well. And they think that the absorption is pretty good with the lotions too through the skin. So if you do run into any side effects with it, I would try lotions or I would try nuts or seeds instead. Melatonin. When I'm talking to people about sleep, a lot of people ask about melatonin. And while it can be good, I actually like to recommend magnesium first. So part of that is because melatonin is kind of it's part of our hormonal regulation. And so there's some questions about if I'm taking melatonin, then does my body make less of its own melatonin? And I just don't know. So I usually like to try other things before melatonin, but there are a lot of good studies that say that it's helpful as well. So it helps reduce the time it takes to fall asleep. They think it's potentially helpful for protecting brain cells. They're looking at it in cancer research and things like that. Could maybe help with migraines, could maybe help with gut issues. There are a lot of things they're studying right now for melatonin, but it's best studied in people with sleep problems. I like to stay on the low end again. So start with a pretty small dose, a 0.5 milligram to 1 milligram, maybe like getting up to 3 milligrams. Personally, I don't like to recommend more than 3 milligrams an evening. Because that's what we think our body tends to naturally make. So that would kind of keep us in our own natural circadian rhythm with sleep. But I do know that people take more than that. And so if your doctor has recommended a different dose, then I'd say that's probably okay as well. Who should avoid it? So there have been some studies saying, it's potentially protective of the brain. It might be helpful for people with dementia or Alzheimer's. However, the big National Sleep Organization has recommended against taking it for people with dementia or Alzheimer's, mostly for I think for falling and waking up in the middle of the night, because sometimes it helps us fall asleep, but we then wake up a little bit sooner. So, but it sounds like they're changing that recommendation. So I would just weigh the risks and benefits if this is something that you're considering for either you or family or whoever. People with epilepsy should also avoid it, I think, again, because of the fall risk. And then people on blood thinners do need medical supervision. So if you're on like a warfarin or Coumadin, those kinds of medications, it can potentially interact there. So I would just let your doctor know so they can keep an eye on those blood count levels. Alternatives, and this is what I would recommend first, is work on your sleep routine. You have a good sleep schedule. Are you having a good routine to help your body calm down at night, turning off screens? Are you getting enough exercise? Is there balanced eating that can kind of support getting relaxed into the evening? And then another alternative is bright light therapy, which is just like a thing you can buy at a store or on Amazon. It's a bright light for like vitamin D, and they think that that maybe helps with circadian rhythms. And so shutting that off by a certain time can maybe be helpful for sleep. All right, omega-3s is a big one. We've known about it for heart health for a long time, but they're looking at it for brain health as well. May help reduce cognitive decline, may fight symptoms of depression, and definitely helps with inflammation. Again, the RDAs are listed here, so that's how much we want to be having between supplements and or with diet. Typically, we're going to recommend a lower dose than what's written up here, so up to 1,000 milligrams a day, typically for what you might want to do with a supplement, but I'd probably start even lower than that. Again, there's a potential interaction with blood thinners, steroids, and corticosteroids. So talk to your doctor if you're on any of those. And really, it's important to avoid taking really high doses of omega-3s because those can cause health issues when we're on way too much. There are a lot of options for omega-3 fatty acids. Fish oil, krill oil, there are a lot of vegetarian products. We'll want to look for a vegetarian one that has algal oil in it, if that's something you're taking. But the most important thing is get something that has both EPA and DHA in it. Of course, I think it's not too hard to get omega-3s in through our diet. So the recommendation is fatty fish 2 times a week. I have those listed up there. Eggs that are like free-range chicken from free-range chickens can have a decent amount of omega-3s just because the chickens are eating bugs and things that have omega-3s in them. And so you'll see typically a richer, like a more orangey yellow yolk in those. And then if you're not a fish eater, there are a lot of plant sources as well. We might have to get a little bit more from plants just with the absorption, but ground flaxseed, again, super easy, mild taste. So you can sprinkle a spoonful on yogurt or oatmeal, mix it into cookies and things like that. It's pretty easy to do. I've even mixed it on rice before and not really noticed a difference in the taste. It just is a really pretty gold fleck color. Chia seeds, walnuts, olive oil, canola oil, edamame. There's a lot of easy ways to get in omega-3s through the day. All right, moving on to gut health, I'm going to get into probiotics, prebiotics, and postbiotics, which is kind of a newer term. I had to do a little bit of digging on what that is, but we might see more of that term this year. Probiotics help introduce new bacteria in the gut. So when you're thinking about our intestinal tract, just the way that we digest things, it's made up of instead of our intestines, we have a lot of bacteria. So we can have healthy bacteria and we can have harmful bacteria. Probiotics are foods that help to introduce new healthy live bacteria. They do think that we need to be eating it daily in order to keep introducing that good bacteria into our gut because they do we're under the assumption right now that even though we may introduce it, we may not be able to keep creating that good bacteria on our own. So if you're taking a probiotic or eating probiotic foods, you want to do it pretty much every day. But it's used a lot in digestive health, helps with immune system, potential benefits with mental health, high cholesterol. There's a big group of people who believe that our overall health is really closely linked to how healthy the bacteria in our gut is. So it could potentially be helping with a lot of different, all different like chronic diseases and that kind of stuff to be determining our outcomes with those things. People with IBS, people who struggle with diarrhea or constipation, and then people who have been on antibiotics recently, those are the people I'm thinking of to start on a probiotic. But really, I think everyone can benefit from having probiotics. People who should avoid are people who are really ill or have weak immune systems because we are introducing bacteria. And so we want to be kind of careful with that. If we're for example, going through cancer treatments or that kind of thing. I would also say don't start it if you're in a flare-up. If you have IBS or Crohn's disease or IBD, just because we want to kind of wait till your gut settles down before we start anything new there. But otherwise, in general, if you're well managed with those chronic illnesses, you should be okay to start one of these. The best option is going to depend on what you want, what benefits you want from it. So there are a lot of different probiotic strains. It depends on the strain of the bacteria. And most of the time, the bottle you're buying will say what the benefit is on it. But I would also do a little bit of digging. If you're meeting with a dietitian should be well versed in this, but your doctor may also. For example, somebody with chronic urinary tract infections, L-glutarate would be the strain that I recommend. Versus somebody with diarrhea, there'd be a totally different strain that I might recommend. But Florastor is a common one that I like to go to. Culturelle is another one that I like to recommend. So there are a lot of like really good probiotics that you could be taking. There's a lot of really great, easy ways to incorporate it with food as well. Anything that's fermented. So if you like pickles, the jarred pickles that are fermented, the refrigerated pickles that are fermented. Same with sauerkraut, the refrigerated ones are going to be the ones that have the live bacteria, the live cultures in it. Any yogurt will say, like, if it has live cultures in it, yogurt's a really easy way to get it in. And then kombucha has been really trendy the last like 5 or so years. It's a fermented tea that we can drink. It's available at pretty much every grocery store now. But it's just like a fizzy kind of sour drink. And so just 2 ounces, just like a swallow a day is good enough to get a pretty good amount of probiotics into you. And like my 7-year-old could drink a whole bottle. He loves it. I would not recommend starting with a whole bottle because it's a lot if you're not used to it. But if you're used to it, like it's fine to drink however much you want. Just find a flavor you like. Prebiotics, these are going to be the food that feeds the healthy bacteria. So if you're making the effort to include probiotics in your diet, you also want to make the effort to include prebiotics. Basically just fiber. So foods that have fiber in it, vegetables, fruits, grains, all that. Helps to support that healthy gut, helps with immune system. Prebiotics, because it's fiber, helps so much with blood sugars, with blood pressure, helps reduce inflammation. I find that people just generally feel more steady energy level when we're getting enough prebiotics in there. And so I feel that everyone could benefit from having prebiotics in their diet. People who should avoid are the same people with the probiotics. If you're really ill, if you're in a flare-up of gut disorder like IBD or diverticulitis, you're going to want to lay low on fiber intake for a little while, but usually after a week or so, or once you're feeling kind of back to normal, we want to start to gradually increase your intake of this again. There's a lot of prebiotic supplements. Most of them are actually paired with probiotics. So if you're buying a probiotic, it might already have some prebiotic in it. I think I feel pretty strongly that we should still include fruits, veggies, whole grains in our diet, just because our body tends to run more. Our bodies were designed to eat real food, so I think we're just going to have better absorption and more benefits getting it from food. But I don't think that it's wrong to take a prebiotic supplement. And then postbiotics. I have not seen anybody taking postbiotics, but I do think this might be a term that we see more often. This is basically when a probiotic, so that healthy bacteria, eats the fiber and then the like gases it produces, which seems really odd, but it's basically the end product of doing the last 2 things. So I guess there's supplements out there that you can take. It's the heat-treated probiotic formulas. I don't know much about it. So anyways, I threw it in there just because I think we might see it. But essentially, if you're doing probiotics, you're doing prebiotics, you're going to naturally get the postbiotics. So I don't know that I will be recommending anybody spend money on this, but it might be something we and probably get some research on. All right, moving into longevity, vitamin D, creatine, collagen, and B12. With vitamin D, of course, we've known for a long time it helps with bones. It also may be cancer protective. It may help with diabetes. It may help with heart health, depression. All of those things, we find that people with higher levels of vitamin D have protective benefits on, but the supplements don't seem to have the same effect. So while I think a supplement is probably helpful, I don't know that it's going to be the big thing that we see a lot of times being promoted with vitamin D. I personally take it through the winter. Like, I think Iowans, we're not getting a lot of sunshine through the winter. It's probably fine to be taking it. I would just also make an effort to get some through food and through sun exposure. Definitely, if you have a deficiency in vitamin D, this is an easy thing to check. Ask your doctor to check your levels. If you're low, absolutely, we want to take a supplement because you're going to need that support to get it up. Anyone who limits fat intake, vitamin D is a fat-soluble vitamin. So I would, if you can, increase your fat intake a little bit if you have a deficiency, especially. But a lot of them are packaged in a little bit of oil as well. But it might be helpful to take it with a meal, especially if you're eating eggs or some yogurt that has some fat. We can just get more out of it. And then anybody who's had gastric bypass surgery is going to be a higher likelihood of a deficiency. It can interact with some medications, so talk to your doctor about that. Dosing, we don't want super high doses. Doctors will recommend a high dose, or your dietitian may recommend a high dose if you have a really significant deficiency, but most of the time, there's like 10,000 international units is a high dose. I probably wouldn't take that unless you've been instructed to take that. Oftentimes we'll take like 1,000 or maybe up to 5,000, but even 5,000 is kind of high. There's a ton of options for vitamin D. I would go on the lower end of that, maybe starting around 1,000 international units, if you're just kind of preventing a deficiency. Typically, we want to look for something that has D3 because D3 is the type of vitamin D that is well absorbed. So that's what we want to take if we're taking it. And then food and lifestyle, sunshine is our best way to get vitamin D in our bodies. But the flesh of fatty fish, so if you're eating like salmon, trout, like cook it with the skin on. If you can't eat the skin, it's okay. You'll get some of that benefit from that anyway. Sardines are a good way if you like sardines. Egg yolks are a good source of vitamin D. And then fortified foods like our grains, our cereals, breads, that kind of stuff, fortified milk and yogurt. And then mushrooms actually have quite a good amount of vitamin D in it just because they absorb so much of it from the sunlight. So you'll see that advertised as well. Creatine is something that I have gotten, I just have more and more people taking, and I just keep seeing this out there a lot more. And I've been skeptical. So I hadn't looked into creatine until I was preparing for this. And now I'm less skeptical. I actually think it might be pretty beneficial for building and protecting muscle, especially as we get older. Potentially protective with cognitive health and just like for healthy aging. People who could benefit are definitely active people. So creatine's not going to be super helpful if we're not doing any activity. But if you're getting some movement in, especially if you're doing any strengthening exercises, it can be very helpful for bone density and just for muscle protection. Again, we want to start with a low dose, which I'll get to in a minute. And then vegetarians and vegans, creatine comes from animal products. So you're probably not getting much, if any, creatine. Our body does make creatine on its own. So vegetarians might benefit from taking a supplement too. I would be leery with kidney disease. Again, it's filtered through our kidneys. So we want to make sure we're drinking plenty of water. We want to talk to our doctor if we're thinking about starting this. But it actually looked like it might be okay. So I think it is a conversation worth having with your doctor. People with hard to control high blood pressure, it might increase your blood pressure a little bit. So definitely talk to your doctor with that. Make sure that your blood pressure is well controlled before you start this. And then again, lower is better. So I would start with just 3 grams a day. It's typically a powder supplement, or I think you can get it in a capsule as well. And creatine monohydrate, again, there's a bunch of different kinds. The monohydrate is the kind that's going to be probably the most beneficial. It's the best studied as well. But from food, any animal products, like I said, will also give you some creatine. I might also just mention with protein here, we don't need insanely high amounts of protein, usually about 20 grams a day. So that's where that palm size recommendation, or sorry, not per day, per meal. That palm size per meal of meat is going to hit right around 20 grams is fine. That might be like 2 or 3 eggs with some cheese, or 2 or 3 eggs with some milk. Will get us some protein, and we do want consistent protein intake if we're having creatine, because it's just going to help support the benefit there. Collagen is another protein. So collagen has been shown to help with skin integrity. It helps with hair, with nails. They're looking at it more and more with joints and with wound healing, so it could be helpful there. I feel like collagen was probably more trendy a year or 2 ago, but I feel like we'll continue to see it. Osteoarthritis, there's a little bit of evidence that it may be helpful there with joints. I've recommended it to people who I just struggle to get enough protein into some patients. Some people just really don't like meat anymore, just really don't like eggs. Like, that's okay. Collagen is not a complete protein, so it's not your best protein source. But it doesn't taste very strong. So it's easy for me to recommend that somebody mix it into their coffee or their hot tea, especially a flavored tea. There is a little bit of flavor with collagen, but I find that it's just not as offensive as some protein powders are. So it's an easy one for me to recommend. And I have had a lot of patients tell me that they feel like their skin does feel a little bit stronger, and that their nails, like I feel like patients I've recommended to it, like they're so excited their nails feel really strong. So that's anecdotal evidence, but I do find that patients tell me that they notice benefits with taking it. If you are allergic to fish or eggs, not for you. And then people with gout, it might actually increase potential for a gout flare-up. Kidney disease, just because it's a protein, I would just talk to your doctor about that, or talk to a dietitian about how much protein you're eating and if it's okay to add this on top. And then vegans and vegetarians, it's an animal product, so you're not gonna, if you avoid animal products. Comes in powders, comes in capsules. It kind of melts, so it's the thing that makes gelatin have its structure. So if it gets cold, it's gonna be a weird texture. But if you drink it in a hot drink, it's gonna be fine. If you mix it into a smoothie, it'll be fine. It's also in a lot of skin creams and moisturizers. I don't know how well the absorption rate is on skin creams and things like that. But you can also get it through food options. So just if you're drinking bone broth, that has a fair amount of collagen in it. The skin on your fish or your chicken will have some collagen, or gelatin has collagen. So you'll see it in those kinds of things. B12, and I had somebody come up before I started and ask about B complex. So I'll mention that here in a minute. B12, I would recommend if you have a deficiency. Again, if you're struggling with fatigue, if you're struggling with neuropathy. And then I also think it's worth mentioning mental health issues. Anxiety tends to be really high with low B12. So if you're struggling with the combination of those kinds of things, I would ask your doctor to check your labs for this. It's generally covered by insurance if you have fatigue, or if you have anemia. That's another reason I would check. Anybody with diabetes who's on metformin for a long time might have a lower B12 level. So there's some different meds that can cause lower levels here. Check it out, and then ask your doctor how much to take. if you should avoid it if you have high levels, obviously. Sometimes it's an absorption issue, so we don't want to take it on top of already high levels. Long-term supplementation may be harmful. Anybody that I recommend take it, I ask them to ask their doctor to check it every year. So we're not running into those high levels. And then apparently I didn't realize this, so it's good to know. There can be an issue with coronary stenting procedure. So if you're having a heart procedure, I'd ask about that, if it's okay to continue taking your B12. Options are going to be B12 or the B complex. Again, if you have a true deficiency, I would take B12. If you're just like, I want to see if this helps, it's a water soluble vitamin. It's pretty safe to take for most of us. The B complex is probably a good option. The difference is that a B complex is just a combination of like 3 or 4 B vitamins, whereas B12 is only B12. So the B complex tends to have low enough amounts of B12 in it that for somebody with a true deficiency in B12, I'd say it's probably just not enough. But if you're just like trying it out, I've had a lot of people say that they started a B complex and they noticed just energy levels improve. Really easy to take, tiny gel tablet, easy to swallow. They also make it an indissolvable. It's fortified in a lot of foods. It's in any animal products. It's also oftentimes in energy drinks. I don't know if you guys are in a big energy drink crowd, but some of my teenagers that I work with, it's like, yeah, their levels are high, but they're drinking a lot of energy drinks. So I want to get them off of some of that. But all right. So this is these are the sources. Most of it is from that government website. Some of it is from a cancer website that just does some integrative medicine stuff. So I would definitely look into any of these if you want to read more. There's a ton more information out there on all of these supplements that I didn't get to. And also the NIH fact sheets are just a good spot if you're considering a supplement. You can just type it into the top search bar and it gives you like all of the consumer information, and there's a page for health providers information, so you can it's both free and available. So that's what I would look up if you are wanting to do some research. One other thing, never mind. We'll take some questions first, but thank you guys for listening.
And for those of you at home, we'll do all the questions in the room first, and then we'll check on those at home. So if you have a question, you're here in person, just go ahead and raise your hand. I'll come around with the mic.
See, I got type 2 diabetes, and I've been kind of doing some research on that, and I'm finding out that a lot of it has to do with parasites. Have you heard about that? And I've been talking to this one doctor who said he had parasites, type 2 diabetes, and once he treated the parasites, he got off his insulin.
So I've heard yes, I've heard about it. No, I haven't researched it yet. So I don't know that much about it. My only thought is because of the gut interaction, there's a lot going on with our gut health and type 2 diabetes. But I don't know how they would treat the parasite to really say too much. But do I think that there's something tied with the gut and diabetes?
Pancreas.
Sure. Well, yeah, and definitely the pancreas. So it'll be interesting to see, a lot of the medications.
Sounds like you're out in the front end of this, that maybe this is a new direction they're kind of looking.
Yeah.
I don't know. I haven't heard it in a lot of mainstream stuff, but I definitely have seen it come up. Yeah.
Yeah, because I had seen something with Dr. Phil's wife had this type 2 diabetes and parasites. He says he's been so busy helping other people that he was kind of ignoring his wife's symptoms. Come to find out, listening to her, I have a lot of her symptoms.
Sure.
So
Yeah.
that is something.
So yeah, ask your doctor about
I
it.
remember Liz has a lot of knowledge. She's a dietitian, and it sounds like maybe to work with your physician.
Well, one of them I'd seen today, and he was clueless.
Okay, all right.
Yeah.
Any other questions in the room? There's got to be questions. I know there's questions.
If there's
I know
not, if
one of
somebody
them-
asks.
Oh,
There's a
okay.
question. I have a question to come back to too.
Dosage for the B12. What's the daily dosage?
Yeah, so that depends. For people who are pretty low, I usually recommend about 1,000 milligrams, but that's like only for people who have had it tested and know they're low. Typically, though, it's a much lower dose. I cannot remember off the top of my head, but it's, yeah. Sorry.
So I want to ask a quick question as you're asking about this. Should people, before they start a new supplement, ask their physician? Because I know like, I'm
Yeah.
glad you talked about creatine because that's something I want to start taking. And I just sent my chart note to my doctor saying, hey, this is something I think I want to start taking. Are you okay with that? She came back and said a couple things and said, yep, I am good with that. But you know, all of these, there's something you're putting in your body and they could react with something or be counterintuitive to something else. So it's probably not a bad, and then
Absolutely.
to ask them what
Yeah.
level.
Yeah, I would ask them, yeah, how much to be taking. And if they say, no, don't take that, I think it's okay to say like, why, or is there something
Yeah.
else that I could be doing? Yeah.
And I had a question. I know with one of them, like you mentioned, magnesium, you would take that at night because it can tend to make you drowsy and whatever. You didn't, I don't know that you mentioned with any of the other supplements.
I didn't. B12, I would do in the morning.
Why? Because I take that and I take that at night, so I want to know why.
Yeah, B12, I definitely, or B complex, too. I would definitely take that in the morning because it helps with energy. And so it can disturb your sleep. So, and I also take B12. I was low when I got checked and was low. So I take B12. I was taking it at night for a while and I did not sleep well. So that's when I do tell people like, take it in the morning. It's going to be probably more useful.
You guys, I've taken this for years and I don't sleep well. I'm
Okay.
very frustrated with
Switch that
myself
up.
right now. Wow.
Yeah.
Okay.
There is timing with creatine as well, but I don't remember it off the top of my head, but I do think it has to do with, it was either before or after exercise when it's most beneficial. Vitamin D, I don't think matters. I don't think a lot of the other ones that I mentioned.
And I would guess most of them, I
Most
think
of them take it.
creatine, now that you say that, might say on
A lot of
what
them
to
will say
take,
on the
when to take
B12
it.
doesn't though, which I find interesting. So yeah.
What is the source of creatine? How is it, where does that supplement come from exactly?
Exactly. I don't know that I know exactly. It's definitely sourced from animal products. So I think it's sourced from the muscle of animals though. And our muscle creates some as well. It's just, they think in the research that our muscles create about 40 to 60% of what we need to really get as much benefit. Or that our body creates about 40 to 60% of what we need to get like as much benefit with like muscle retention. And we lose muscle as we age. And so supplementing with those small doses can help kind of like meet that other 20 to 40%. I don't know that I might have answered around your question.
Well, and I think it comes from beef, from cows, doesn't it?
Google says that creatinine comes from, well, dietary creatinine comes from animal product. The supplement form is chemically created and is suitable for vegetarians and vegans who typically have a lower natural intake.
There we go.
Oh, man. I thought it came from animals.
No,
I
haven't verified that.
mine says it.
When I looked it up, I have a friend who's vegan and I looked it up and what the one we just found right away was said suitable for vegetarians. So yeah.
Back to magnesium.
Yeah.
I'm just sure on my bottle, it says to take 2 to 3 a day. Well, you're not to take 2 or 3 at the same time, are you? If it's to be taken in the evening.
I've only ever known to take it in the evening, but again, I would ask your doctor about it
Okay,
if you've been told something different. Yeah.
thank you.
And I have to correct myself. It was collagen that I believe
That
comes
you're-
from
Collagen is usually from, but you can get it in chicken as well.
And chicken, but I'm pretty sure mine even has a picture of a cow on the
So
front of it.
supplements usually from cows, yeah.
It makes me feel really
And
good.
collagen I know is from the bones of cows, so like, I do know that one, but yeah.
Are there any that should be taken alone or should be taken with food? Does it make a difference? I don't know that it always says on the bottle if it should be with food or alone.
Trying to think through the ones that I talked about today. Yeah, the vitamin D needs fat, so that one might be helpful with food intake. The probiotics, I would assume, will be better with food intake. A lot of the other ones that I mentioned, it's not like coming to the top of my mind that we need to have it with food. So I talked about so many though that I don't know for sure, but nothing like specific is coming to my head. Yeah.
I'm gonna look online. Does anybody else have a question here? If you do. just go ahead.
While you're pulling up
yeah.
online, I had somebody bring up, before the presentation started, this ARIDS too. I know a lot of eye doctors are a big fan of ARIDS. And again, talk to your doctor before you start it. It's vitamin C, zinc, copper, vitamin E, zeaxanthin, and lutein. I have looked into it for patients who have asked me before, and I think it's a good supplement. And at the same time, like, there are things in here that are oftentimes found in other supplement blends as well. So I would just look and make sure, like, zinc is oftentimes in other things as well. Vitamin C is in other types of supplements really commonly, and vitamin E as well. So just look at your whole list and make sure that you're not taking too many of the other things since it's a combination. But otherwise, if this is the only thing you're taking, or if you're not taking very many things, then it's, I think, probably a good thing. I think there are quite a few studies showing that it's protective for our eyes, like integrity. Yeah.
Oh, here's a question.
What do you know about animal supplements like dogs, cats, horses, cows? What supplements are they needing every time because they're in confinement?
I guess you would think you'd need more of a veterinarian
Yeah,
or somebody
yeah,
or a
a
vet
veterinary
dietitian.
scientist.
Yeah, yeah.
Let me make a comment then. Well, that's kind of where I'm coming from because I worked with supplements that were for veterinary use, and all dogs, cats, horses, parrots, they all need supplements, especially if they're in confinement. And you know, are we all people in confinement? We need supplements.
Yeah.
A couple of years ago, we all felt like we were in confinement, didn't we?
It's kind of interesting.
We were.
There was one thing at the veterinary college about vitamin D, and somebody did not put that into the supplement, and all the pigs were breaking up every kind of disease. They were wondering, what the heck is happening? They have all these different various diseases. Somebody forgot to put the vitamin D in the supplement.
Oh,
Yeah.
shoot.
And so that when they had questions, I raised my hand and I said, well, how much vitamin D do people need who live in confinement?
I will say, I feel like people hopefully have a variety in their diet. And so we're going to get a lot of things just from the foods that we're eating from, like, hopefully you're getting outside. So I think our risk of deficiency is probably lower than a lot of animals might be that are in confinement. And yeah, as long as you're being very thoughtful with your supplements, I, as a dietitian, tend to try to help people figure out, like, lifestyle first. And then if we're still running into some issues, if we're still running into issues with, like, neuropathy, or people are still feeling really tired all the time, then I'll go into supplement discussions with my patients. But I think there's oftentimes a lot we can do just with our lifestyle. Sleep, stress management plays such a huge role. if we're thinking about blood sugars alone, oftentimes when I see a spike in somebody's blood sugar, like, was this a really stressful, like, did you eat? Like, if they say no, it's like, well, did something stressful happen at 3 o'clock on this day? And then you're like, yeah, actually I had a really tough conversation with somebody, and like we see a spike. And so I think those kinds of things can also just play a huge role in how we're feeling. So if we're looking at those first, and we're not going to be perfect, nobody's perfectly not stressed and eating all the fruits and vegetables every day, but if we're making an effort most of the time, we might feel pretty okay. These are kind of things that I'd say, like, is kind of like the cherry on top of the ice cream. Like, the ice cream is the really good part, but the cherry is like nice to add if we want it. So I don't feel like I don't want anybody to walk out of here and say, oh, I gotta go buy something. I'd start with your lifestyle check-in first, and then, you know, if you're still missing a component, do a little research on what might help that.
I recently started working with a new doctor in the process to prepare to see the doctor. I just got all my prescriptions, all my supplements, the surgeries I've had, all that data, put it together. And I was trying to figure out how to present this to her instead of just give her a stack of paper or what. I actually went to an app, which is an AI app, which is Perplexity. I don't know if you ever heard of it. And I put in all of my medications. I take 9 medications.
Mm-hmm.
And I asked it, are there any interactions that could be of concern? And, you know, put in my supplements as well. It gave me that information, and which I printed out and gave to my doctor. A fair amount of it she wasn't aware of.
Sure.
So if you use AI to do this type of research, make sure that they actually have good resources. They're not going to some guy in a garage someplace in New York and ask for his expertise. But I actually put in there my height, my weight, my age, and I kept adding information. They kept giving me new information out.
Yeah.
And I printed that out and I gave it to my doctor. She didn't read it the first visit, but the second visit, she says, I think this is great. So I'm not saying that takes the place of a doctor. I wanted to verify it with a doctor. But at the same time, it's a tremendous amount of research, and it gives you all of any information it gives you the source. So you could check the source that it came from. Because if you don't know the source, again, I don't want some guy in a garage someplace telling me how much vitamin D I need to take, you know?
Yeah. Or if Wikipedia is the source, maybe we need to double check. Yeah. I think AI is cool for things like that, to just like kind of get your thoughts going. I am very cautious of using AI too much to rely on for health things. But yeah, I think it's okay to kind of bring up questions to ask your doctor about supplements, for sure. Yeah.
Many supplements indicate that the certain ingredients are 250 to 300% of your daily requirement. Now, if you put that in a different perspective, so instead of 1 beer, you're recommending 3 beers. So instead of taking 8 ounces of 8 glasses of water a day, it's recommending 24 or 30 glasses. That's really a high overdose on everything. It doesn't make sense to recommend any of these supplements that are giving you an overdose of 3 to 4 times more than you should have.
Yeah. I'd say the percentages are based off of a 2,000 calorie diet a day, and everyone needs a different amount. So the percentage of 300% might be really high for some people, and it may not be enough for other people. So the percentages, while I think they're a good reference point, I do sometimes, like the 1,000 milligrams of vitamin D is like 10,000% of our daily value. But somebody with a deficiency needs that much to like make up for what they've been missing out to get their blood volume up to a normal level. But I'm also with you, like, I think it doesn't make sense to be taking a bunch of vitamins that are all at 300 or 400% of what an average person might need, because it probably is just too much. One way to check on that is look at the color of your urine. If your urine is a really dark yellow and you're doing a decent job with drinking enough water, you're probably on too many supplements. So or you're having too much protein, one of those things. So that's where I would start asking questions. Because most of our vitamins are water soluble. So the urine is just like a good way to see, like, am I actually absorbing this or am I just paying a lot to just wash it out, sort of a thing.
So that brings up a good question, because I used to be on a multivitamin, and when I went to my doctor, it became evident I'm one of those that has to do the 10 times the amount of vitamin D. And I take B12 and I have to keep my levels. But when I went in, I said, well, I take a multivitamin. She goes, why? I said, I don't know. I thought I should. I'm, how old, whatever. She goes, these are the two I want you to take. And she didn't want me to be on, and kind of like you said, why be putting, I'm not trying to discourage anybody from a multivitamin, especially if you've talked with your physician and whatever.
Yeah.
But to me, that was just very kind of counterintuitive. I just thought, well, I'm taking a multivitamin,
Yeah.
but
My perspective is like, if you're somebody who's eating a pretty varied diet, you may not need a multivitamin. I don't think it's harmful to take. So if somebody wants to take a multivitamin, I'm not going to discourage them from taking it. If somebody is like, I really don't want to take a multivitamin, but I'm looking at their diet and they eat the same like 10 foods all the time, I'm probably going to encourage them to start taking a multivitamin. Or, obviously I'm working on increasing variety of their diet. So yeah, I think that's also just really individual on, does it make sense to take or not?
I got another question. When you take a supplement, there's a few things that I've done research on, and I'll take the supplement, and it appears that the supplement will work in a particular area for me. It's really difficult to determine whether or not it's actually succeeding.
Mm-hmm.
Now, I have had things that I've taken when I had problems with my hands. I play guitar, and if I'm having problems with my hands, that's a big deal. But, I've taken a few supplements and I'm better.
Yeah.
That's pretty good, clear-cut evidence.
Yeah.
But a lot of stuff that you take, it's unless you get blood work, how do you know?
Yeah. I'm going to use a specific example to maybe answer that question. For example, like magnesium, when I recommend somebody take magnesium, I usually recommend they give it 1 to 3 months to decide if it's helpful. If their sleep is not improved in between 1 and 3 months, just stop taking it, is usually what I say. And so that's where, again, I get really curious about, like, why are you taking this? And if I'm not noticing a benefit in that, at least within 90 days, I would stop it.
Yeah, I have a question. I didn't even have like a vitamin check until I ended up going to a bariatric clinic. And why aren't people getting vitamin checks? That way we know what we're overdosing on or underdosing on. Because they keep up with me, not my doctor. They keep up if I need something.
Yeah.
Yeah,
So,
why don't we do that?
yeah, with bariatric surgery, because we're oftentimes changing the structure of our intestinal tract, we're not going to absorb very many. There's a lot of vitamins that may not get absorbed very well. So they're going to be a lot more invested in, like, what are your vitamins looking like, just because there's a huge risk that you might be deficient in things, even if you're eating those things. With the general person, though, our intestinal tract is like pretty smart. And so it's most likely we're absorbing most of the things that we're eating. And that's where I think with insurance coverage, like vitamin D oftentimes isn't covered unless you know you have a deficiency, and then it's covered. And so unless you're willing to pay out of pocket for that initial test, your doctor's probably going to be hesitant or like kind of choosy on what they recommend to get checked. So that's where, yeah, you kind of do have to advocate if you want things checked, or you need to know what symptoms you're experiencing if you want to have a vitamin checked, because like vitamin B12 oftentimes is covered but we
Yeah.
need to have a symptom
Yeah.
to say, why we're checking it. I think it comes down to just cost, probably. Yeah, for most.
Yeah,
instances.
I was wondering, I wanted to go back to the postbiotics. Are you referring to products like Vino or anti-gas products, those kinds of things?
No, I honestly don't know. I don't think we know, like, I haven't seen it out there yet. It's a really new term. So I think it will be called postbiotics. Yeah. Vino is more so just like helping you break down gas. So it does so it's able to be released versus just like a bubble. Yeah. Kind of just that. So
I've noticed too, a lot of our supplements are made in China.
a lot of our
If you
stuff
read
is
the
made in
label,
China.
I
Yeah.
mean, do the ingredients go by standards that they have for supplements, or do they go, I know the United States doesn't have any because on the bottle it says, not,
Mhm.
verified for,
Yeah.
any disease.
Yeah, that's why I want people to do that, third-party testing research. It was on one of my slides here. I don't know. The screen is frozen, but on one of the slides, I have 3 places listed of quality testing. And so, yeah, I don't know what kind of testing like China or other countries might be doing on their supplements. Some countries probably do a better job than we might, but I imagine not all of them are. Also, like when I'm working with somebody, this consumer testing, when I'm working with somebody, I oftentimes have specific brands that I might recommend just because I know that there are dietitians on the board of this brand, or that I know that they're using, for example, collagen sourced from cows that are grass, pasture raised cattle, and they're, whatever. So I do think we have to do our own research on that.
You touched on bright light therapy, but what is that?
Yeah, so there's a lot of different products. It almost looks like a little tablet, and it's just like a bright light that you would have kind of shining on your face. So it can help with mood. But I think it also can help with circadian rhythm, kind of like they say when you wake up in the morning, the best thing to do is look outside or be outside. That helps kind of set our circadian rhythm, the hormones that our bodies are making to wake up and then to relax and sleep. So you wouldn't want to do bright light therapy at night, probably more so in the morning, but it might help you create those melatonin hormones to be able to sleep better at night. Yeah, good question.
All right, looks like we got the questions, lots of great questions and very wonderful and informative presentation, Liz. Thank you so much for taking time this afternoon. As a reminder, if you will fill out complete your evaluation, give us any other ideas for topics or presenters you would like to hear from. And then our next program is actually next Wednesday, Strategies for Forming Healthy Habits, 2:00 down here. And then after that, it's Wednesday, February 11th, down here, 2 p.m. It's on Your Healthcare, Your Say, Exploring Advanced Directives. So thank you for coming today. Thank you, Liz. Stay warm out there, everyone, and have a great day.